Let's go live now to Dr. Kathryn Snow, infectious diseases expert from the University of Melbourne. Dr. Snow, thanks so much for your time. Let's start with this ban on gatherings. Why is that figure of 500 plus being adopted by the government?
Look, I think, the government needs to draw a line somewhere, and obviously, where you could draw that line is debatable, but I think the message is very clear now that stopping large gatherings is absolutely the way to go, and these are the types of measures that we've seen be successful in China and in Singapore.
So if you look at this situation of gatherings like football and so on, why is that treated differently at this point to, say, travelling on a train or something?
So one of the big challenges that we've seen with this virus is we've seen some events where large gatherings like conferences and sporting events, when one person has been there with the virus, they have passed it on to significant numbers of other people. And sporting events and things like that, where you have people coming, from interstate and from a lot of international visitors at those events, means that they're a particular risk.
And would you suggest that we're getting ahead of the curve here? Is this getting in early, or is this the minimum that you would like to see from our government, from our leaders in terms of reacting to this virus?
I think this is appropriate given where we are now. In Australia, we're still not seeing huge numbers of cases, but it is really important to act early. So I think bringing these types of measures in now is absolutely the right thing to do, particularly given that we've seen these measures succeed in other places.
You are an infectious diseases expert. Give us, our viewers, a sense tonight. Even though the numbers are less than 200 as we speak this evening, is it inevitable that they do climb to the thousands, the tens of thousands?
Look, nothing's inevitable at this stage. The numbers absolutely will climb, and I think a really critical thing for us as a country in the next few months is making sure that that happens slowly. The situation that we've seen in Italy is what happens when the numbers rise very quickly, and that has had a disastrous impact for the health system in those affected regions. So these types of measures that the government's bringing in are designed to slow the virus down, and that's incredibly important because that gives our health system time to adapt and time to manage the situation.
So the capacity of the health system to be able to adapt, and that slowing of the virus might assist in that. And as you say, if it can avoid a situation like Italy, that'd be a huge step forward for us as a nation. The Prime Minister now questions as to whether he should be tested after Peter Dutton is being treated tonight in a Brisbane hospital with coronavirus. Can you give us a sense of what the situation is there? Should all of the Cabinet be tested, given they've had contact with Mr Dutton this week?
I'm sure they're getting medical advice about that, and I think it's very good to see that people in the government are also following medical advice and following the advice of health professionals. That's what we all need to do in this situation, is keep on top of what the latest advice is, because the situation is changing rapidly, and it's good to see that the PM is following that advice.
Yeah, indeed. Well, I appreciate your time, Dr. Snow. Thank you very much for that and for your insights from the Melbourne University, Dr. Kathryn Snow.